Good morning. It is Tuesday, March 1st. Welcome to the Morning Medical Update. Thank you so much for joining us here live on Facebook, YouTube, and now on Twitter. March is Colon Cancer Awareness Month, and it's not just middle-aged people being diagnosed. It's hitting the much younger population. More and more people in their 20s and 30s are now being told they have it. We'll talk with Dr. John Ashcraft. He is the chief of colon and rectal surgery here at the health system about why it's so important to get tested early. Plus, we're going to talk with patient Kayla Delich. She's a young mother. She's going to share her story as she was diagnosed with colon cancer at a young age as well. Also, we're going to talk with Toby Cook. He is the director of public relations. He's going to join us with a very unique behind-the-scenes look at the health system. In this morning's medical headlines, here's some good news for people like all of us here in the studio and all of you other coffee drinkers out there. New research finds caffeine can reduce your risk of heart disease. Researchers say that caffeine lowers bad cholesterol levels, which have been known to cause coronary heart disease. Development is now underway on new caffeine products as potential therapies to treat cardiovascular disease. People who have been diagnosed with stage 3 colon cancer are not at an increased risk for disease recurrence or death if they eat red meat or processed meat. That's according to a study published by JAMA Network. In earlier studies, high consumption of red meat, as well as other bad foods and alcohol, had been linked with an increased risk for colon cancer. Having a pet later in life may slow down memory loss. Researchers with the University of Michigan found that pet owners were able to preserve their cognitive health longer by helping to reduce loneliness and depression, which both have been associated with cognitive changes. So please get your questions sent into us on YouTube, Facebook, and the Medical News Network. You can find links right there on your screen. But now let's turn to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us with our COVID count. Good morning to you. Hi.
Hi. Yeah, that's a good thing about the caffeine. Although
Right.
I think, and Dr. Ashcraft will certainly can weigh in and answer these. You know, we hear all these studies, and one study says one thing, and another study says another thing, and it does cycle through. But I mean, I think that's good news for caffeine. Caffeine is a good medicine or a good drug, if you will. Again, taken in the right quantities. So, and I do love my coffee. Today, the cases, you know, we are steady, really in those mid-40s for active cases. We have 45 active infections today. Luckily, only 2 patients in the ICU, which is always a good thing. However, 2 of those people are on the ventilator, so 2 of 2 are on the ventilator, and 77 in that recovery period as well, so a total of 122 patients right now. But, you know, I think we are still seeing that downward trend overall, and that is a great thing.
All right. Thanks for the update. See you here in a bit. Let's see if there's any reporter questions on the line today. All right, I think we are good to go. All right, so it is a scary number. Colon cancer is the 3rd leading cause of death. That is according to the CDC. Researchers say as many as 10% of cases are hereditary, only 10%. The rest are results of lifestyle and some unknowns. We're going to talk more about that. They say that those who are inactive, smoke, drink alcohol, eat and snack, have a bigger, greater risk of developing colon cancer. And you might be surprised to learn that more people in their 20s and 30s are now getting it. So the big question is why? Why is this younger population being impacted? For that answer, we're going to turn to Dr. John Ashcraft. He is the chief of colon and rectal surgery here. And we're also going to talk to one of our patients, Kayla. She's a colon cancer survivor. She's a young mother. Good morning to you. Are you unmuted?
Good morning.
Hi, good morning. I know you're at school. You're a school teacher, so thanks for making those kiddos wait for just a second while we talk to you. We're glad to have you today. Hang tight. I'm just going to ask Dr. Ashcraft a couple of questions. Why? Why are we seeing people like Kayla and other people in their 20s and 30s being diagnosed with colon cancer in particular?
Oh, I wish I knew the answer.
I know.
That would be the really gold chalice right now if we could figure out that answer. And there are people working on it. There's been several hypotheses that have been presented. The first one being processed foods. We've eaten more processed foods than our parents. Our parents ate more processed foods than their parents, and et cetera, et cetera. And so there's a hypothesis about the amount of processed foods. Definitely there's a hereditary link to it, but like you had said, only 10% of our colon cancers have a genetic component to them. And so we don't think that's as much of a component as we thought it was. There's research into microbiome, the bacteria that live within our colon. Everybody has their own individual microbiome. Mine's different than yours, than Dr. Hawkinson's, and et cetera. It's based on where we live, how we grew up, and the foods that we ate when we were growing up. Definitely, we are becoming a more obese society. That plays a role into it. And so I think that there's a component of that. And then other things that might play into it is our dietary and things like that. But overall, we don't know the answer. It's a scary phenomenon. If you look across the board, the colon cancer rates are decreasing. But then we have this subset of the population, these younger patients, much like Kayla, who are increasing, and we don't know why.
And you were talking with Kayla a little bit before we started the show. You said this is exactly who we're talking about, just that big mystery. Kayla doesn't look like somebody who would be diagnosed with colon cancer. And tell us the truth. Is your diet bad? Is there anything in your lifestyle? We know it's not in your history because you told us it's not in your family history, Kayla, but this must be a mystery to you as well.
Yeah, it's one of those things that was just kind of blew our minds. Like, I was a college athlete. I'd always taken really good care of myself, and just never really imagined that this would have been the cause of like our infertility issues. That was the reason why I started going to the doctors.
Because you have a 4-year-old, so you were diagnosed when he was very young. So you're telling me that you got married, you started having fertility issues. Is that so? Colon cancer was probably the farthest from your mind. How did that connection get made?
Well, I didn't have fertility issues until we were trying for baby number 2, and we just kind of stayed the course and tried for a while, and it's been about a year, and I'm like, okay, let's go find some answers. I'm only getting older. And then that kind of led me down the path of like, let's go see a GI doctor. And then COVID hit, so that kind of like sidelined all of that, because that was right at the beginning of the nationwide shutdown. And so that kind of pushed all of that back. But I never really imagined that I was going to wake up from a colonoscopy with the news that you have cancer.
Yeah, what was that moment like to hear that word so early in life?
Terrifying. And I was alone. That was one of the pitfalls of COVID. No one was allowed in or back with you. My person is my mom, who was with me, was out in the car waiting on me to come out, and she never imagined that I'd be coming out and have to tell her those words either. So that was just an interesting, chaotic time for me. Really, I had been told that I had hemorrhoids just from giving birth. It's pretty normal, they would say, and since all of my symptoms were kind of inconsistent, and that would not to worry, like it's not a big deal. And she finally was like, well, let's just go check and make sure everything else looks good. That's why I got a colonoscopy, and things were not good. And so I wish that I would have known what I know now, and I would have advocated for myself to like have someone go in and like confirm that's what it was. Like from the moment that I was told, that's what was causing the bleeding.
Kayla, thank you so much for sharing this very personal story. It's just really nice, don't you think, that people are able to talk about it? It's something that can affect any and all of us, right?
Yeah, and Kayla's message is prime an example that be an advocate for yourself. We used to always trump up bleeding, especially in our young patients, much like Kayla, who just had a baby. You're right. Oh, it's hemorrhoids. It probably was. 90% of the time it's going to be. But it's that 10% of the time or whatever that we're going to miss something. Getting a colonoscopy, as I'm sure Kayla would attest to, is not as bad as what people think. It's the prep that is always the worst, but the procedure itself, you get a nice nap out of it, and then you wake up and you're through it. And so they're very safe, 1 in thousands of risks, not that common at all, and super easy to get. I agree with you, Kayla. Be an advocate for yourself and get your colonoscopy.
But I know, doctor, this is, like I said, it's kind of a bang your head against the wall moment, because you're like, we just don't know why this group. I want to bring up some charts that you have brought to demonstrate this, but you said colon cancer rates are going down, but 20 to 34-year-olds, a 90% increase?
Yeah, if you look across the board nationally, the rates of colon cancer, the incidence of colon cancer is dropping, and it drops year by year by year. But if you subset that into the age groups, you get that 20 to 30 and 30 to 40-year-olds, and they're increasing, and it goes into that we don't know why.
Has the pandemic played a role in this?
Oh, yeah. So Kayla's story, again, just a tremendous and phenomenal story there, Kayla. We are seeing so many patients, not only in colon cancer, you can relate this to breast cancer and other cancers, where there are good screening guidelines and are good screening tests. You should go get your colonoscopy. Don't delay it. I know that the pandemic delayed a lot of people getting their screening colonoscopies and their diagnostic colonoscopies. But right now is the time to catch up. Get in, get your colonoscopy. It'll save your life.
Another chart I want to show is, again, cases going down by 100,000 people, and that is according to the latest statistics from the CDC. 90% increase in that 20 to 34-year-old, but that decrease, do we know what's causing that? That is some good news.
That is good news. So the overall decrease in colon cancers that we see, and the chart that was up was showing that colon cancer is the third leading cause of all colon cancers. But we are seeing that the annual rates of colon cancers are dropping year by year, and that's really due to probably two big factors. One is that we're understanding how we're getting it. We're controlling obesity a little bit better in our populations, and we're controlling our diets and changing our diets. The other thing is really the screening colonoscopies. Our rates of screening colonoscopies are increasing year by year, and we need to continue that trend. Colonoscopies, the job for a colonoscopy is not to catch the cancer, it's to catch the polyp or the precursor before it turns into a cancer, and that way you never get the cancer.
So Kayla, you were diagnosed with stage 3 rectal cancer. Tell us about the treatment that you received.
Yeah, so I had 9 rounds of chemo, IV chemo. So that was biweekly from August to November. And then I had 28 days of long course radiation alongside chemo pills, which took me at the end of January.
And you are cancer free.
I would like to say yes. We're still kind of monitoring that every 3 months. So we celebrate being no evidence of disease. So I guess that would mean Dr. Ashcraft cancer free. I don't know. I don't like to say it. Knock on wood.
Help us understand that then, doctor. When we say cancer free or no sign or evidence of cancer.
Evidence of disease.
Yeah. So help us understand the difference between the two. Is cancer free really a term? I know she's going to continue to scan, I'm sure, for a lifetime.
She will. You know, we watch our patients very closely. Rectal cancer is we always talk about colon cancer as this broad topic, but it's really colon and rectal cancer. And they're two different beasts treated completely different, much like Kayla talked about. She got radiation, and we give radiation for our rectal cancers. We don't do that for colon cancers usually. And so the fact that she got her treatment and she's now in what we call surveillance mode, where we're watching to see if this is going to recur. We really watch very closely for the first 2 years. About 80% of all recurrences will recur in that first 2 years. And as long as we're not seeing anything, we say NED, no evidence of disease, much like Kayla just said. That's a great term we love to hear. We try to get away from cancer-free because we know that there's still about 20% of patients that it can show up a little later, and so we're going to keep watching her. She'll get CT scans on a very regular basis, be seen in clinic on a very regular basis, and we're going to watch her closely. And when she reaches that 5-year mark, then you can that's a good celebration time.
So when we see this increase, the 90% increase of those 20 to 34, yet you don't get screened for colonoscopy until you're 45, help me understand that.
Oh, I wish I could help you understand that. You know, I was pleasantly happy when they went from 50 to 45 years old. And I wish they would have went a little bit younger to maybe 40 years old, but we'll take what we can get. The other thing I'm hoping they'll get away from is that interval between 10 years. We used to go 10 years between colonoscopies. I'm hoping they drop that and we go no more than 5 years, but we'll see what the recommendations come out and how they mature. But that's where the government put the guidelines, and that's where we are. But much like Kayla said, you can be an advocate for yourself. She had bleeding.
Yeah.
Anybody that walks in my clinic, if you have bleeding, I don't care how old you are, you get a colonoscopy.
Whether you like it or not. And I know you looked at me sideways this morning because I told you how old I was.
I didn't say that.
And yes, and you said you're going to make me an appointment as soon as the show is over.
Yes.
Okay, I missed my colonoscopy. I'm going to make my appointment today. So if somebody is past 45, has not had a colonoscopy, get in immediately,
Yes,
correct?
please.
And certainly if you missed it during COVID, missed those screenings. So I want to talk with you, Kayla, a little bit. I know you're a teacher. You're a love teacher. I know we have some pictures of you, I think, in your classroom, and people were showing you the love, and I know you're a young mom. Through all this, at the end, you have a permanent colostomy bag. So tell me a little bit about what that has been like, and then Doc, I want to just talk with you about what that actually means and how that's going to help her long term.
that was probably one of the scariest parts of all of this, not really knowing with rectal cancer, like, will I be able to have a lower anterior resection, or will I be waking up with a permanent colostomy? And, getting through chemo and radiation was just one of the steps. And I would say, like, this, waking up from surgery and relearning how to, like, deal with life has been the easiest step of the way. Like, I would encourage anybody that's, like, somebody says, this is a real possibility, to just take it in stride. And if you didn't know, you wouldn't know, honestly.
So you're telling me just the fact that you're able to live life and be healthy and be present and be a mom and keep teaching your kiddos, that's really the best news ever, right?
Yeah, it is. And I, thank goodness for high-waisted pants being back in style. But other than that, it's just a normal part of my day now. I mean, I don't even hardly think twice about it anymore. Past like the healing stage and, learning how to like use all of my new appliances and finding what works best for me. But once I did, like, it became very easy. Like, I still swim, I still work out, I still play with my kiddo, I still do everything I did before this happened.
Yeah, she's making it work. So tell everyone exactly what that is. And is that she was diagnosed at stage 3. Does that have an effect on the outcome as far as if somebody were to need a colostomy, or what other treatments? And
Sure.
Tell us about that.
The fact that she's stage 3 did not impact the fact that she got a colostomy. Unfortunately, that's really the location of the tumor, a very distal, or a tumor that's very close to the anal canal, going to higher chances of having a permanent colostomy. The thing I would key in that Kayla said, and it's really important, and I love her for saying it, she's just amazing, is she can't find anything she can't do. Yeah. She can do everything. She swims. She's athletic. She plays with her baby. She's an amazing mother and a teacher, and that's what I think is key. A colostomy has a stigma with it. She's totally beating that stigma, and she is amazing.
She kind of kicked colon cancer where it counts.
She kicked it in her you-know-what.
Yeah, I like it. I love that, Kayla. Okay, first of all, just how are you feeling now? So you're feeling good. You feel the day-to-day. You feel good. You work, and energy to chase your 4-year-old around?
Yeah, I feel really good. I honestly can't, like, it's just one of those things that it's hard to believe that it's honestly been so long since I was, like, in the thick of it.
Let's talk about the home test. Are those effective?
So this is the first few years that the home tests have really, truly, I shouldn't say the first few years. We've always had fecal occult blood testing where you would take a sample of your stool and test it for blood, be it through an immunohistochemical test or be it through just putting a drop and looking for the change in color. Those tests have always been on the market, and they've actually been around for years and years and years. But the new test, the Cologuard that people see, which is the multi-test DNA test, where it actually tests for the DNA mutations that are in colon cancers in your stool, those are more new, and they just hit the guidelines. When we changed to 45, they really hit the guidelines as well. They are good. If you cannot get a colonoscopy for some reason or don't have access or for whatever reason, it's a great adjunct to a colonoscopy. You do have to do it a little bit more frequently, every 5 years, as opposed to at least at most every 10. But the key thing I want to reiterate to patients is a colonoscopy, number one, is not that bad. And number two, they can catch it before it turns into a cancer. Cologuard catches things pretty late in the game.
Okay.
The colonoscopy can not only catch it, but it can treat it. It can remove that polyp before it turns into a cancer, because we know the vast majority of these cancers start out as a polyp and then collect mutations and turn into a cancer. If we can catch it as a polyp, you never get there.
So in the spirit of being your own health advocate, tell folks listening and watching what that conversation should be like with their doctor. If they feel like there's just something wrong and they're not at that age to get screened, what should that conversation be like with their physician?
Much like with Kayla, she was having bleeding. They kept attributing it to hemorrhoids, but after a period of time, you have to say, this is still going on. I'm really concerned. I really think that a colonoscopy is an appropriate test right now, and I think that we should choose that as a method for looking into this. I don't disagree, don't argue, just say, yeah, I'm sure it is hemorrhoids, but can we please do a colonoscopy? I just want to look deeper. And especially if you have a family history, inform your healthcare provider. That should be a knee-jerk to get your testing.
All right, we're going to get to some community questions here, but I do want to get to our last screen that you had up, which was really a topic no one wants to talk about. I want to end on a high note today, but the cancer death rates. If we could pull up that full screen, please. Can we just talk a little bit about how those rankings go with death rates and just what we want people to? We kind of want to hit people between the eyes, so people really are aware and wake up and make sure they're getting their screenings.
Yeah, of course. When you look at it across the board, colon cancer is the third leading killer of all cancers, depending on your sex. So for females, breast pops in there. For males, pancreatic pops in there. And then lung is always number 2, whether you're male or female, and then colon cancer is number 3. The good thing about colon cancer, much like with breast, is we can catch it early if you get your mammogram. You can catch this early and actually prevent it if we get your colonoscopy. And so for those reasons, we can really make a dent in those numbers. We can really do some great prevention if we can just get our screening up.
Okay, so are there any dietary suggestions you have? Is there any foods that we eat to keep colon cancer away or things? I mean, we know the bad stuff, but is there anything really good that we can run out and really stock up on?
In societies where they eat a high fiber, low fat diet, low red meat, they've been shown to have decreased rates of colon cancer. There are some studies out there, and I want to make sure you're talking to your healthcare provider before you jump on this, but there is a lot of data out there on aspirin use to prevent colon cancer. Actually, it helps prevent the polyps. But be cautious before you do that. See your healthcare provider before you jump on that.
Okay, I have to ask the question. So are we supposed to be observing our
bowel movements?
Bowel movements.
Every day.
You're supposed to look at them.
You should.
And what are we supposed to see? What are we looking for?
You want them to be...
Are you supposed to be proud of some and some are... Yes.
Always.
Okay.
The prototypical thing I always educate is you want them to be soft, shaped like a banana, and float. If they float, you're getting enough fiber in your diet. If they are too hard and you're straining too much, you're going to lead to other problems like diverticulosis, diverticulitis, hemorrhoids, things like that. You're really looking for that just soft shape like a bowel movement. You shouldn't have to strain too much. That's what you want.
All right, I had to ask.
You have to.
Have to ask. Okay, let's get to some questions because we've got some good ones today. Isaac is asking, so we have our proton therapy center that's coming, right? Curious if that might play a role in treating colon cancers. Do you know? Or could it in the future?
That's great. So much like Kayla talked about, again, she's a great example. She got radiation. She got long course radiation. So she went through 5-6 weeks of going to the radiation therapy every day. She's a trooper. She did it. She got some chemotherapy pills with that. Again, not the funnest part, but she did it. The mainstay right now is radiation. We either do it in what we call short course, where you get it for a week, or we do long course, where you get it for 5 to 6 weeks. And so that's been our mainstay. Proton beam has not played into it yet, but there's tons of research going on it.
Yeah, you never know. Okay, Joyce wants to know if a polyp is discovered during a colonoscopy. First of all, just what does that mean, or what could that mean? And would that mean you would need chemotherapy?
So no, a polyp, if they catch it, when my GI group sees a polyp, they will remove it if they can. And if not, they'll biopsy it and mark it so we know exactly where it is and what it is. Then, depending on what it shows, would determine what we do next. Most polyps are not cancerous. It's going to be an adenomatous polyp or a hyperplastic polyp or some terminology like that, which just means it was at risk for turning into a cancer. But 9 times out of 10, they're going to remove it, and you'll be done with it.
I think I know your answer to this one, but Bridget wants to know, is the Cologuard test effective enough for a low-risk individual over 50? And if what she's saying is it would be in lieu of a colonoscopy, I know your answer is no, but is that something people could do while they're waiting out that 5 years?
Yes.
If they're concerned.
Yeah, no, that's a great question. I have to say that the guidelines do say you can use Cologuard, so I'm not saying don't use it. It's just if it turns out positive, the result is you're going to need a colonoscopy anyway. If you get the colonoscopy, they can catch it early. And there is a miss rate with the Cologuard that we want to be cautious with. They don't catch everything, and so colonoscopy is really the gold standard.
Okay, and we are really getting a lot of questions about these tests. Sharon wants to know, are the non-invasive colon tests effective? Is that what she's talking about,
Same
Cologuard?
thing.
Okay.
Same thing.
All right, just double checking. Other symptoms. What symptoms should people be looking for? We talked a little bit about it. Is there any unusual symptoms that somebody might have? Is there any abdomen pain,
Yes.
other than maybe bleeding? But what else would you
Again,
suggest?
Kayla found hers by having difficulty with her pregnancy. I have to admit that's a very minor one, and it's a very new one for me. But the typical description is bleeding. I think she described that. That's going to be your first and kind of trigger. Weight loss that you can or cannot explain, that's something you want to think about. We always see patients who have cancer seemingly lose weight for some reason or another. Your belly becoming distended or bloated, which you cannot explain, and staying bloated. That's kind of a scary feature as well. A change in your bowel movements. We talked about bowel movements a second ago, and there's always a point in time where your bowel movements will change depending on what you ate. You went out and ate Mexican, or you did this or that. Well, they'll change for a little bit, but they should swing back to the normal. A patient who has colon or rectal cancer typically will have their bowel movements change and not come back to their normal. And that's kind of a thought that you should think about too.
All right, good stuff to look out for. Okay, Angela wants to know, if I had a small polyp taken out, no cancer, should a person have a colonoscopy sooner than every 10 years? So should she request that? Make sure she's she's communicating with her doctor that she had one
Sure.
taken out, or does it just have to be cancerous?
No. So once you get your initial colonoscopy, everybody wants to know, when do I get my next one? The answer really is, it depends on what they found. They found one polyp, but we didn't know what type it was. Was it an adenomatous polyp? Did it have cancer cells in it, but they got it all out? Hyperplastic, serrated. There's all these different types of polyps, and how big was it, and where was it, and things like that. And does the GI doctor think they got it all and not? All those factors play into when you should get your next one. And so you really just need to talk to your GI doctor about that and see what that polyp looked like and go from there.
All right, we are going to get to some final thoughts here in just a moment. If we get some more questions coming in, I will make sure to get those in. But I do want to tell everyone about something. It's really a great way to enjoy food and also help out a great cause. You may remember late last year, the owner of Q39 lost his battle with colon cancer after 5 years. There on your screen is a QR code that you can use to help keep Rob McGee's memory alive here at the health system and in the fight against colon cancer. The link will take you to the KU endowment page where you can donate to help support research into HIPEC. That is a treatment for mesothelioma. I said that wrong, but that's a big word, and I don't do those well. Q39 is also donating part of its proceeds to colon cancer research here at the KU Cancer Center with a special smoked Reuben sandwich that you can get at its restaurant. And this is going on all month long. So March 1st today, all the way through the end. So you can click on that QR code there on your screen for more information about that. So anyway, just so we always get so many great questions about this, Dr. Ashcraft. So just some final thoughts as we head out today. What do you want us to know about keeping our colons healthy?
Get your colonoscopy. Don't be afraid of it. It's not that bad. I've had one. Kayla's been through it now, and she's probably actually already had another one, I would hope, or getting ready to have another one. It's not that bad. It's not that scary. I think she'd be the first one to tell you, go get your colonoscopy.
Okay, and I'm going to get mine scheduled today in honor of you.
Thank you.
You're welcome. Okay, you'll be proud of me.
I will.
Kayla, thank you so much for being with us today. Just what do you want us to know about staying healthy and being, again, an advocate for your own health care and just knowing your body?
Yeah, I would just encourage everyone, just like Dr. Ashcraft said, like, a colonoscopy is easy. It's not scary. Do it. If you are in question, ask for it. If you feel like there's something going on in your gut, whether like your diet or something's just not right, it's better safe than sorry. I'd rather, and it's easier to treat when you don't have to go through all the chemo and the radiation. So just that colonoscopy, man, it's important.
Well, we appreciate that. And just how do you stay so positive and up? I would imagine it's your young 4-year-old and all those kids at school that you support. And let's give a shout out. Where do you teach and what grade do you teach?
I teach 5th grade at Junction Elementary in Turner. We, the kids really helped me through it. Their families, my family. It really takes a village to kind of go through, the long treatment of cancer, and you lean on the people to help you get through the hard times, and then you have a bunch of people to celebrate with when the good things roll around. So I think the more people you surround yourself with that are on your team, the easier it is to kind of keep that positive mindset and tackle one small step at a time.
Yeah, I think your support team is like half of the treatment, don't you think? That's like literally 50% of getting yourself well. Would you not agree?
No, 100% agree. And much like she said, it does take a village, and you got to find that support. And Kayla, you're amazing. You went through it amazing.
Thank you so much, and stay in touch, okay? And be well.
Thank you. Thank you.
Thank you. Dr. Hawkinson, I want to get to your final thoughts, but I have to ask you, have you scheduled your colonoscopy?
No, I definitely need to. I will special request Dr. Ashcraft.
So a 2-for-1.
So,
we could do a 2-for-1 colonoscopy special.
We're not going to do Katie Couric, though. We're not
No,
going
we
to
are
do
not.
any of that.
No,
It'll
we'll
be private.
That out. Yeah.
First, I would just like to thank Dr. Ashcraft. I know that myself and my ID colleagues know and understand such an invaluable service he provides to our ID clinic and our HIV patients. So thank you. He is a very thoughtful and compassionate surgeon. And his main goal is to identify any cancers early and really protect you from further problems, as we heard our guest talk about as well. So that's about all, really, my final thoughts. Again, we know cases are going down. The message has to continue to be, if you haven't been vaccinated or up to date with vaccination for COVID-19, please go get that. In addition, for your general health, please talk with your medical teams, get those screenings done, protect yourself. The earlier you catch any of these things, overall, the better off it's going to be.
All right, let's make our appointments today. It's a deal?
All right.
All right, let's do it. Okay, we're excited to bring you some great new online content brought to you by this guy. He's kind of a familiar Kansas City face. Toby Cook is our Director of Public Relations, here to share what he's been working on. How are you?
I'm doing great. How are you doing?
I'm good. Have you had your colonoscopy?
54 years old. I was 4 years past the 50 mark, and I finally got it a month and a half ago.
And you lived to tell?
I lived to tell. I had 2 polyps. They were benign. I shouldn't have waited that long.
Okay.
That's going to be a colonoscopy themed story that I'm going to tell with this new venture that I'm starting here in a couple of months.
Okay, so tell us all about that.
Well, I'm starting a blog,
Okay.
and I think the last person on my block to start a blog, but it's okay because I started here at the health system back in April of last year, and my hope here is to be a chief storyteller here at the health system. I've been having the opportunity to tell stories about what's going on at the health system online and with our speaking engagements that we have set up to talk about all sorts of great things. But this blog is really going to be something I hope is going to be a person that has been in Kansas City for about 24 years, who has watched the University of Kansas health system from afar, been a fan, but had no idea what was really going on until I got inside these 4 walls. And this blog is going to happen this month.
Well, we are excited that you're inside these 4 walls. You are like me; we're both recovering news people. And so, what has the transition been like to come here into you're into healthcare,
Yep.
But now you're going to be back telling stories again. That's got to feel pretty good, right?
It feels great. I was in broadcast journalism for about 15 years, and I got to tell people stories every day. Then I spent about 14 years with the 2015 world champion Kansas City Royals, who are going to get there again. They're on their way back. And after 14 seasons with the Royals, I joined the health system. And the most difficult transition was not trying to learn healthcare and all the acronyms. That was difficult enough.
Right.
What was difficult for me after years of kind of winging it, kind of flying by the seat of my pants, knowing what my story was that morning and having to tell it later that day,
Yes.
was that I had to learn an awful lot about how we tell stories around here. And it's strategic, it's involved. We run it by a lot of people because we don't want to get bad information out. Not that I was telling bad information on TV with the Royals. I was doing it more from a feel.
Yeah.
And this is both feel and also data. Evidence, accuracy.
Yes.
And it's been an adjustment and a wonderful one.
Well, yeah, you find yourself asking a lot of questions. I say we get to sit in between and next to all these really smart doctors, and I try my best to pronounce big, long words the best I can, so I'm learning as we go. Dr. Ashcraft, Toby Cook, have you guys met? Hello?
Nice to see you. You were great this morning and very, very helpful.
Well, good. Well, so where can people find this blog? You're starting it this month.
Correct.
Where do we go?
On Wednesdays starting this month, not tomorrow, but soon, you can go to kansashealthsystem.com. We're also going to point to it on all of our social media accounts, not all of them, but many of them, and I'll do it on my own personal accounts as well. But on Wednesdays, we'll hit you with this blog, and just to give you a flavor, the first one's going to be about what we just talked about, my transition from broadcasting to baseball to the University of Kansas health system. But another idea we had was, this Dr. Stites and this Dr. Hawkinson were all of a sudden television stars in Kansas City the last couple of years, and we're going to talk a little bit about that. There's a great cancer physician, Onalisa Winblad. Her grandfather delivered me and my siblings 54 years ago. And I love that connection between, the family connection between who becomes a doc, who doesn't become a physician from their siblings and their nephews and nieces. And then I got to spend a day or two cleaning the hospital with this, when non-clinical people were jumping in and helping out in housekeeping, in dining, in transportation. Terribly eye-opening and a wonderful experience. So those are just some of the things we'll be talking
And you
about.
met some really neat people doing that.
Unbelievable.
And just quickly, father of 5?
5 kiddos.
5 kiddos.
Yep.
Oh.
2 were out of the house, 2 were in the house, 1 was back and forth, and they keep coming back.
They're never
So,
going to leave you.
Yeah,
They can't stay
exactly.
away.
Yeah.
We are really excited about this vlog. So,
too.
and then you're going to come back here and share stories and talk with us and hang out.
Yep, would love to do it.
Love it. Okay.
Get your colonoscopy.
Thank you for
At
that.
40
message.
years old.
Yes. Okay. I'm making mine today. Okay, everyone. Thank you so much for being with us. And don't forget, you can catch our shows anytime by logging onto Facebook, YouTube, and now on Twitter. Okay, coming up tomorrow. It is more than just a passion. Our Chief Medical Officer, Dr. Steve Stites, puts on his professor hat along with 4 other distinguished guests tomorrow to debut a new regular feature he's been working on for some time now. Tomorrow begins the first episode of Show Me the Science. For the last several weeks, we have dived into 2 drugs, one that's FDA approved and the other that comes with warnings from the FDA. That is tomorrow at 8 a.m. We'll see you then.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.